Well, Professor Sachs, thank you ever so much indeed for joining us.
Pleasure.
You said in your address, you looked at the progress that's been made in the last 10 years. What progress is that?
There's been a tremendous amount of progress in reducing the burden of disease in poor countries, in confronting the three great pandemics that confronted the world in the year 2000, the AIDS pandemic, TB, which was riding on the back of AIDS, but also had developed, of course, drug-resistant tuberculosis, and malaria, which had suffered the loss of its first-line medicines, needed new medicines and new techniques. So for those three pandemics, there has been a tremendous achievement. And more generally, we're seeing child mortality rates come down, health systems scaled up, international financing for health scaled up as well. Of course, the progress is partial. There's a ways to go. But compared to where the world was in 2000, I think the progress is absolutely notable and very significant and very reassuring.
But has some of this progress been made at the expense of the fabric of the health systems in some of those countries? That's a point that's made over and over again.
I think that's not a right analysis because there has been tremendous improvement. But it's important to remember that in the poorest places, effectively, there were no systems at all 11 years ago. So there are still places where the systems are highly deficient, underfinanced, where human resource problems are severe. But there's been a tremendous amount of progress, which I've seen with my own eyes across Africa and across Asia. We have national scale programs in Nigeria or in Kenya or in India, which are making a tremendous difference in those countries. Of course, there is a ways to go. I'd like to see it go faster because I think it can go faster. Our report indicated that more aid can translate highly effectively into disease control. That's been proved right where it has been applied, and I think more can be done. I'm still quite concerned, of course, about the plateauing of donor assistance right now, and most especially about the cancellation of round 11 of the Global Fund program, which I regard to be a very serious setback indeed.
But in your address, you talked about a crisis. You said we're at a crisis point. What did you mean by that?
The US and Europe are in an economic crisis, but more than an economic crisis, in a political crisis, because we're both very rich societies. We have the means to take on not only our internal problems, but to continue to help finance the solution to global problems. But that's not happening right now. Europe is consumed by its euro crisis. The US is consumed by its internal blockade of reform. And in both cases, therefore, the global agenda is slipping past the fingertips. Some countries are taking heroic efforts to keep up the effort. The UK, I think, is extremely notable among those cases. But other countries are letting the aid budgets slide and being diverted from development assistance to domestic crises that ought to have been solved more easily, still can be solved easily, and should not divert us from the goal of saving millions of lives per year in the poorest countries.
You also talked about the role of leadership in the US. Now, you look at all the global health programs run by US universities, you look at all the programs that the US itself runs, and how big an issue now is that lack of leadership coming out of the US?
The US indeed is the largest donor in the world because it's by far the largest economy in the world. The US played a major role in the establishment of the Global Fund. And in the private sector and in civil society, there's been a tremendous uptake of interest. Among my students and students around the United States, there's phenomenal interest in public health. It's seen to be the completely riveting and exciting, dramatic, dynamic profession that it indeed is. All of that is extraordinarily heartening. But in Washington, it's not heartening what we see. It's utterly disheartening. And the U.S. Hasn't yet collapsed as a donor, but it has plateaued. And aid is now being cut back. The U.S. leadership is being cut back. The distractions to U.S. problems are absolutely evident. And we're seeing crises as a result of this, not only in the health field, but in climate change and in other areas as well. The U.S. for a long time was clearly the world's leader on a lot of initiatives, did a lot of things that many of us didn't like as well, but it did provide a lot of leadership. But unfortunately, we're not seeing that leadership now out of Washington, though we still see very heartening cases coming from civil society, from universities, from philanthropies, and so forth.
So 10 years ago, you knew exactly what needed to be done. What needs to be done now?
We need to continue to realize that public health as a science and as a profession works. What that means is to move from epidemiology, identifying the burden of disease, to a scientifically derived set of interventions, what can be done about those diseases, to management systems that can deliver those interventions, to financing models to enable those management systems to operate, to results, monitoring, and evaluation. That's what I consider to be the science and the practice of public health. It's effective. 10 years ago, we faced huge challenges against the Commission's findings that we ought to invest in AIDS, TB, and malaria. The skeptics said it won't work. Plain and simple. You could put money in, but you won't get better health out. That has been proved to be false. We have put money into malaria control, and malaria deaths against baseline in Africa are down by about 39%, according to the current WHO estimates. We've seen tremendous progress in treatment of HIV-infected individuals. We've seen successful applications of DOTS throughout the poorest communities of Africa and the world. Public health works, but it requires investment. To my mind, the Global Fund to Fight AIDS, TB, and Malaria has been the single most important investment of the last decade. The donors have not met their obligations right now. It's not sensible what they are doing, holding back. When they canceled round 11, as they did, this is a huge setback. And the most urgent thing of all that's needed is reinstating round 11 early in 2012 so that the dozens of countries that were preparing plans for global funding can get those plans funded, and we can continue the successful scale-up of the fight against the 3 pandemic diseases, but against the heavy disease burden more generally in the poor countries. I believe the Global Fund to Fight AIDS, TB, and Malaria should become the Global Health Fund to fund basic health systems, not only addressing those 3 diseases, but also the neglected tropical diseases and the basic health, the professional cadres at the local level. If this is done, we can see 10 years of even more dramatic progress because the technologies are better than they were in the year 2000. The breakthroughs have already been shown. The use of mobile and other information and communications technology can make a world of difference. We're on the threshold of great advances, but we need that model of linking the epidemiology, the interventions, the management, and the financing, putting the package together. If we do that, and the careful monitoring and evaluation to make sure we've done it, then we will revisit the Commission report in another 10 years and see even greater breakthroughs and move to that world that we have longed for of health for all.